Hey y'all, it's now been 7 months since I had MMA, maxillomandibular advancement surgery, otherwise known as double jaw surgery, to hopefully cure my sleep apnea. I got a new PSG, a new sleep test done, along with a day sleep test, an MSLT, that I now have the results for it. So I had an original sleep study done 3-4 years ago, and that was an at-home sleep study, and my results were with a 6.1 AHI. Now I was led to believe, the same with my doctors I saw after that, that AHI was low because of the at-home sleep tests often underscoring what the true events per hour are for a person. If you want to see more details about how I ended up ultimately choosing to get double jaw surgery, please check out my other videos. I've got a ton of good videos covering that. But eventually I did get double jaw surgery. My specific surgery plan was for my bottom jaw to move 10 millimeters forward, my top jaw 9 millimeters forward. I was impacted by 1 millimeter and I had counterclockwise rotation. I also had some nasal bone shaving while under for that surgery that helped remove some nasal polyps, just overall to help improve my nasal breathing. Now, months after the surgery, my poor sleep and my poor daytime wakefulness were still largely present. Although I definitely did see big improvements and still have these improvements, but that led me to ultimately get a follow-up sleep study along with that day test that I mentioned earlier. I had a new AHI of 0.8, and that sleep study showed 0 fully obstructive events. I had 3 to 5 hypopneas, depending on how you score them. I did have around 50 spontaneous arousals, which I'll get into later, but also the results from my multiple sleep latency tests, which is used to screen for other sleep disorders like narcolepsy, type 1, type 2, or idiopathic hypersomnia. My MSLT came back where I had the opportunity to fall asleep 5 times in one single day, and I fell asleep every single time. My average of that was 6.2 minutes. Out of those 5 naps, I had 3 sleep onset REM. The criteria to get diagnosed for narcolepsy is 2 or more early REM episodes in these quick naps that you're given. My doctor I was working with at the time diagnosed me with narcolepsy. I'm not sure if I'm fully confident in that diagnosis. The double jaw surgery that I had was big movements, and I'll show everything on screen, with big improvements in my pharyngeal airway. My aesthetics are good too, I guess, although that wasn't my main concern. My breathing is better, and my airway feels bigger. And I really didn't have any complications regarding the surgery. And so that, in some ways, that was a success. And that PSG came back and said, sleep apnea is now cured. And then the MSLT following that was narcolepsy is now diagnosed. After getting those results, I was at least trying to be confident in those results and what my physicians were prescribing were my issues. And so I ended up seeing further doctors, particularly a sleep medicine neurologist, a very specialized, very good doctor. And I sent him all my results, and he was comfortable with committing to the idea that my sleep disorder breathing is gone, and that these hypersomnolence conditions, for me, narcolepsy, are the most accurate for me. And so I ended up committing with his prescribed treatment, which were pharmaceuticals, after a pretty lengthy conversation that we had. And so I ended up taking modafinil for a couple of weeks. That's a wakefulness promoting agent that hopes to improve daytime wakefulness for narcolepsy patients. I didn't feel like I got much benefit from that at all, if not got worse, as it seemed to kind of string me out along each day. And so the next step was taking armodafinil, which is a stronger version of modafinil, along with, I was prescribed Zolpidem, or the brand name is Ambien. And so I took a combination of those for a couple of weeks. I noticed the armodafinil was perhaps a little bit stronger. Really, neither of these wakefulness promoting agents seemed to noticeably do much for my energy levels. And the Zolpidem at night seemed to lower my awakenings by 1 or 2, and it kind of knocked me out. I seemed to get a little bit groggy in the mornings afterwards. But the summary here, really, this segment about these pharmaceuticals I tried for narcolepsy, these pharmaceuticals kind of made me feel worse. And so then I started questioning these treatments and the diagnosis itself. I was already aware that, hey, if these new sleep tests come back as showing that I'm okay, they could sometimes be wrong and be skipping over a condition like upper airway resistance syndrome. I hopped off of the pharmaceuticals. I'm off them still to this moment. And I ended up trying different treatments to figure out really what's going on. I ended up taking a much more heightened focus towards my nasal breathing. I've been doing consistently nasal strips to keep my nasal valve collapse or nasal walls open. I've been also doing Flonase and Astapro, saline sprays, neti pot, and antihistamine during the day. Along with that, I also have started tackling or being much more intentional with my acid reflux. I have mild acid reflux, but I've had it my whole life. I've never really gotten ideas or pushed to treat it whatsoever. The doctors were just unsure why I had it, even at my young age. So I've done some antacids now. I've been more consistently taking alginate products that build that raft on top of your stomach. And I've been making sure not to eat late at night, eat less spicy foods, all of that, which has helped my acid reflux. And by the way, all that nasal care that I was talking about also has made me breathe better. The results pertaining to just having better nasal care and more of a focus on my acid reflux did not by any means fix or cure my sleep. So I ended up switching, or adding rather, bi-level again back into my form of treatment. I'm still getting used to having a machine back on my face, as it's been 7 months since I've had to do that. Whether I stick with this bi-level, I'm not sure, but I thought, let me give it a try, see what the results are, and maybe that will give me a better idea on which kind of diagnosis I should go with. You know, am I narcoleptic, or do I have UARS, upper airway resistance syndrome, or is it a combination of both? And the reason I was scoring as a narcoleptic on the MSLT was because of intense sleep debt or deprivation from a persisting sleep disordered breathing condition like UARS. And to note, what gives the UARS diagnosis for me a little bit more validity is because with my PSG, I was scored with 50 spontaneous arousals. And if you're familiar with the scoring and the community that kind of keep track of people's success with treatments, you know that sometimes RERAs, respiratory effort related arousals, are sometimes hidden or not scored or underscored. And actually you can find their true number of RERAs in the spontaneous arousals category. If you ask for my opinion now on what I think it is, I really am not sure. I would probably lean more towards the UARS as a possible condition that I need to have resolved to see significant results. If I end up being more certain about my narcolepsy diagnosis, that would probably end up with me looking towards the pharmaceuticals like Xyrem and Xywav, these sodium oxybates that seem to really have promising results. If I lean more towards UARS, it would be more of a future of me using bi-level and titrating that for myself to get as restful of sleep as possible, as I then schedule out surgeries that could be like palatal expansion, as I haven't had that, and or nasal surgeries. And to characterize my symptoms that are present right now are that I definitely have brain fog, some memory troubles, excessively tired, fatigued, and sleepy during the day. I have some kind of like post-exertional malaise or exercise intolerance if I do too much physical exercise. And then my sleep, I probably awaken roughly 5-ish times a night that I remember. And I don't feel rested when I wake up or at any point during the day. I also wanted to add, I only have numbness from the jaw surgery now left in my bottom lip and downwards in this area, kind of the chin area. And it's really coming back. It was originally maybe 80-90% numb, and now it's probably 50% numb. Other than that, I can't really think of anything else relating to the surgery. I don't have jaw pain. I don't have much swelling, if any, left. I also forgot to mention, I did not have my tongue tie removed yet. I'm gonna wait to do that for a little while, but I am over a month into orthodontia. So I just have these clear liners on, and they're supposed to give me about 5 millimeters of added width in my palatal space. After I have the results of that dental expansion in the next 6 months total, I will get my tongue tie cut. And so as I learn to test and verify whether UARS or narcolepsy is more prevalent or most applicable to my case, I will keep y'all updated on this channel. A big thank you to the support so far on this channel. My videos have been doing really well recently, and I've really surpassed my expectations, so I appreciate that. And I appreciate the help from some of my subscribers. I won't name them because I didn't ask if they want to be named, but for the assistance with understanding my own case. I set up a Patreon, a brand new one to my channel that does have a little bit of exclusive information. I wrote a couple blog posts. One was about the carnivore diet that I've tried in the past and how that affected my sleep. I also wrote another one showing the before and afters of my wisdom teeth removal and my thoughts on that procedure and how it impacted my own airway. I've got 3 membership options. One is just $1 a month. It has limited spots, but it's just for my original supporters at the moment. And then bigger options for committing to my Patreon, $5 and $10 a month, which come with their own benefits, like me shouting out your name or business name at the end of the video. But I won't gatekeep from y'all any really critical information about my case. This is all going to be out to the public. I also now have a scheduling service where you can schedule and do phone or video calls with me. It's very cheap, very affordable. I'm no medical doctor or really an expert in this field, but I'm just someone who's going through this whole treatment process, all these different diagnoses I've had, and different avenues I've tried. And so if that's useful to you, or you just need a listening ear for how tough the daily experience can be living with a sleep disorder, you can book me.